Welcome back. You're watching African Perspective. A U.S. missionary is being sued by mothers in Uganda who claim her medical facility under serving his children is responsible for the death of their children. Two mothers, alongside the Women's Pro Bono Initiative in Kampala, have filed a lawsuit against Renee Bach and her NGO, alleging that she's responsible for the death of their children at the medical facility. After their children died, they learned that the district health officer had allegedly ordered the facility to be closed in 2015. More than 100 children are said to have died to date. We're now joined on Skype by a journalist who broke the story, Raymond Mujuni. He speaks to us from Kampala. Raymond, a very good evening to you, and thank you so much for taking the time to speak to us here on African Perspective. When first did you hear about these allegations?
Thank you so much for having me. The first time I heard about the allegations, I'd been approached by one of the mothers, actually. A friend of one of the mothers actually reached out to me and said that it had been strange that one of their children had actually died in what they said was a medical facility. And that they said that the medical facility was run by then, what they were telling me, a missionary. And of course, what sounded strange for me when I first heard the allegation was that the missionary had come into the village, picked up the child and taken them for medical treatment, and then thereafter brought them back when they passed on. In a country like Uganda, where access to health can be a bit tricky and difficult for people in the village, it's actually strange to hear that there's teams that are going out into villages and actually picking patients and bringing them to the health centers. So it sounded odd and sounded off. So I started to look into it.
What year was this, Raymond?
This was last year, actually. Last year, probably around July.
Okay.
Yeah. So when I started looking into it, I found that there's a group that had done some work there, No White Saviors, who, when I talked to them, they were ready and willing to give me information on what they'd gathered in terms of the evidence that they'd collected around the case. So I got the evidence, and after getting that evidence, I decided to actually go out into the field and get my own evidence. When I started the search, I actually discovered that it was actually broad. The well-funded group that Renee Bach ran was dealing with malnutrition in Eastern Uganda. Malnutrition in Eastern Uganda is actually a big problem. So when they started to deal with that problem, they were actually attracting a lot of funding from the US back into their non-profit, and then they were using that non-profit to treat children. But what struck me was when I actually got the staff rota for the non-profit and cross-checked it with the doctor's role, I discovered that they actually had only one registered doctor, and yet they purported to have over 7 or 8 doctors who were treating children. I also discovered that Renee herself was not anywhere trained as a medical doctor, or even trained in delivering healthcare. She just got a passion to deal with malnutrition in Africa, and then, of course, transported that white savior complex onto the children in my UK. So I investigated that story for about 4 months, and we released the documentary on it. Of course, when the documentary came out, Renee refused to speak in the documentary, and we made various attempts to actually get in touch with them, and still we didn't get anything from them. When the documentary ran, it caused quite the storm in Kampala, both in Parliament, outside of Parliament. And a month after the documentary ran, the mothers of the children that had passed on inside the facility sued Renee Bach.
But let me stop you there, because I need to understand why people in Ginger, for instance, actually believed that Renee and all the others were doctors. Some say it's because she was dressed in a white coat and a stethoscope. So did she pose as a doctor?
Yeah, definitely. On many occasions, she did pose as a doctor. Let me just give you the context of Ginger. So Ginger is a town in eastern Uganda. It used to be an industrial town. but it has since collapsed as an industrial town. Many of the people who live in Jinja Town are formerly workers of industry who are now redundant. But also, Eastern Uganda has the highest poverty levels of the country at the moment. So we're talking about a population that has largely poor people and largely uneducated people. And we're also talking about a population that many agencies that are doing missionary and volunteer work come to. Jinja, again, for context, is one of the most beautiful towns of Uganda. The longest river in Africa, River Nile, flows from it. They have Lake Victoria, they have a raft of tourism opportunities. So, what happens is that when many of these tourists actually come into the country, they then sign up to do missionary work in the Jinja villages. And during that missionary work, they pass off on many occasions as doctors. So that's what actually Renee Bach, even in her own storytelling, said that she came to Uganda first, I think, as a volunteer and to tour the country. And after seeing what was happening in Ginger, decided that this is a problem she could solve. And then she started to collect money for that and started a non-profit, and then used that non-profit to treat children. Of course,
Did she register this non-profit? Did she go through the correct channels, official channels, to be able to work there or dispense the aid that she felt she could?
what she registered in the country was a non-profit, and to the extent that she registered it was that she would be raising money and using that money for advocacy around malnutrition. What in effect she did is that she started to run a health center, treating cases of malnutrition and actually even admitting cases of malnutrition into what she said was an ICU unit. So she was running what you would call a health center, and without the specialists required to treat malnutrition, because malnutrition requires the treatment of a pediatrician, and she didn't actually have any registered pediatrician on her payroll.
So I believe, Raymond, that there is an email that was sent to authorities saying that they have proof that Renee gave an account of how she put an IV in a malnutrition child and how she treated that child, but that child later died. Is this true?
Well, what we investigated in our documentary was that child. The child was called Twalali Ali. I believe that his name should be known because that way you humanize the boy. So Twalali was a young child living in Masese, which is another village in the Jinja townhood. And he was picked up by Renee and taken for what was quote unquote malnutrition treatment. Um, that boy, from the medical records that we got in our investigation, was actually suffering from tuberculosis. And the doctor that they first encountered, Renee took the boy to a trained medical doctor who told them that this is a case of tuberculosis. But what in effect happened is that Renee admitted the boy for malnutrition and then started to feed him on supplements. Now, the pediatrician we talked to in our story says when you find someone who has malnutrition, whether it's acute or not, and you give them supplements, you must be able to maintain that diet over a close period of time until they are in fine and stable health to return to formal meals. So what happened is that for Twalali, after the treatment, he was sent back into his home. And first of all, the home wasn't feeding him the supplements that he was being fed at the health unit. But also, when the family brought him back to the health unit did not take him to a health center for treatment. They kept him at the non-profit with the guys that they were treating him. As a result of that, of course, the boy passed on.
How many
And his
children like
parents had never been-
Mwalali have died, Raymond? And was it all under similar circumstances?
By the time we ended our investigation, we were talking about tens of children. But I've since seen numbers that mention hundreds. I've not been able to verify that. Of course, it's true that the non-profit has been taking in hundreds of children in terms of malnutrition care and treatment. But in terms of the numbers of children that have died, those that we investigated and verified, we're talking about tens of them. And at the time that we closed off our investigation, we'd at least talked to 15 of parents that had lost their children in a manner similar to the way Swalali lost his life.
Raymond, Renee has denied the allegations, serving his children, have denied the allegations that she acted in any way as a medical practitioner. How are they refuting the claims that are out there?
Well, first of all, they are refuting the fact that they actually took in these children. They're refuting the fact that, and this is what I've seen in the court documents that they failed because they were not able to respond to our investigation to date. They're refuting that the doctors on their role had the required medical expertise to treat malnutrition, but also they're refuting the fact that these parents had an interaction with them. But you see, what's strange is when we were doing our investigation, we actually gleaned a lot of information off of Renee's blogs, off of the non-profit's Instagram account. And after our investigation ran, a lot of these, actually, after we sent them an email to clarify on the pictures that we'd seen on their Instagram and on their blogs, they deleted these pictures from their social media accounts. So that, of course, for us was a strange development that even when they are filing the court papers and denying a relation to some of the parents that they're talking about, we have screenshot accounts of their Instagram and social accounts that show that these children were actually in their custody and care.
You spoke about the white savior complex earlier on. I want to understand how widespread is this problem in Uganda. You spoke about ginger and how it draws that, but just how many incidents such of these have we seen as a result of this white savior complex?
Yeah, so in context, the white savior complex starts with colonialism. There's no story of white savior complex that's more telling than that. The idea that by virtue of my color, I am capable of coming to your country and picking up an issue that I think is affecting you and trying to solve that, whether or not I have skills or whether or not I'm actually capable of solving that, is what this white savior complex is. And it's what is the overriding motive at the end of the day, that, you know, there's a lot of non-profits running in Uganda of people who say, you know, I was seated back in America and I looked at all these children suffering down in Africa, and then I came down to try and save them. There's a lot of that posted on the social accounts of the non-profits too. There are black babies without whose consent, without parental consent, who are posted on the accounts of these of the non-profit, and for campaign purposes. You have carefully selected images that portray a severe malnutrition problem in Ginger, when in fact it's just 1 in 10 children that suffer severe malnutrition.
I have to ask this before we end off, Raymond.
Yes.
What has been the reaction of the government in Uganda, and what are they doing about it?
There's been 2 reactions. So first, the non-profit that Renee ran had been closed by the government of Uganda. But then it also dubiously, as we had asked in our investigation, it was dubiously reopened, and it actually operates inside of a government-certified health center. Yet the Ministry of Health tells us that they don't know about it. But also the other most profound reaction that we've had is that legislators have been demanding that the immigration authorities in Uganda actually rein in on the white savior complex. They rein in on the number of people coming here to deliver quote-unquote medical aid, and actually demand that these are trained professionals that are ready to actually do work in their scope of training. Yeah, so that's been the level of reaction that the government has. Yeah.
Thank you so much, Raymond. Really appreciate your time and filling us in about your work, and we commend you for that. Thank you very much. Raymond Mujuni is a journalist speaking to us from Kampala, Uganda. He broke that story about the deaths of children in that country following claims that they were treated by a bogus medical practitioner running an evangelist aid organization serving his children. There are procedural and regulatory mechanisms that ought to be followed when establishing a medical facility in Uganda. Even so, the law provides for licensing agencies and protocols for those who should practice medicine in Uganda. That's according to Beatrice Kayaga, an officer at the WPI. She said this in a press release recently. Well, that brings us to the